Colon cancer is actually quite common, contrary to popular belief. It is the third commonest cancer in Kenya after cervical cancer and breast cancer.
There are many surgical options available, and this depends on the stage of the cancer. The stage of the cancer basically implies the extent at which the cancer has spread.
If you think of diseases, colon cancer is the paradigm that shows you go from what we call a polyp, which is like a pimple. It stays that way, is a nuisance, but doesn't do very much harm. You get a mutation, the polyp becomes an adenoma, which is like a boil. That adenoma becomes a villous adenoma, where you have another mutation, and then becomes a carcinoma. So you've got this progression over 10 years in which this happens from a polyp to a carcinoma, which is why if you pick it up early, during those stages before it becomes a carcinoma, the cure rate is 100%. If you wait and the carcinoma develops and then goes into your lymph nodes, stage 3, metastasizes stage 4, the cure rate goes from 100% down to 40%, down to 10%.
Colon cancer is one of the most common cancers in both men and women. This is after breast, cervical, esophagus, and prostate cancer. Experts say that if diagnosed early, then you stand a higher chance of being cured. My name is Dr. Mercy Korir, and on this episode of KTN News Health Watch, we speak to experts at the Aga Khan University Hospital about screening, surgery, and chemotherapy for colon cancer.
We also now need to concentrate on colon cancer because often it's considered a taboo topic because of the invasion of the colon. People feel that you really don't want to talk about it. But the incidence is increasing everywhere around the world and even in younger people. So we need to be aware of this.
For this group of doctors, it is important to break these taboos and speak about a cancer that when caught early can be cured, adding life to one's years.
Colon cancer, breast cancer, prostate cancer belong to the triad where diet makes a big difference. Obesity is a promoter of all these three cancers. Too much red meat, promoter of all these three cancers. Lack of exercise promotes all these three cancers. So as we become very westernized, we are losing the protection. So while we may want to dress like the West and behave like the West, I think we should stick to our habits of diet, exercise, and we should all be like Kipchoge Keino. We should run.
Dr. Devani, a consultant gastroenterologist at the hospital, explains that what you need to look out for may actually not be there because of the nature of the intestines being hollow. By the time you pick any symptoms, it may already be late.
Well, the commonest presentation, or no presentation, is no symptoms. That's the commonest cause. You may not know anything about this cancer because don't forget, cancer occurs in a hollow bowel where it actually has space to grow. Unlike breast cancer where you can actually feel it. Here you can't feel it till it actually grows to quite a sizable size. Now, what can happen in patients who actually seek medical attention is, for example, they start bleeding. Bleeding, now you'll be interested to know, can be of different types. It can be bright red in bleeding, it can be purple in color, it can be dark red, or it can be black in color. And that's all bleeding from the gut somewhere. So they can present with bleeding, they can present with pain. Pain is usually a late sign because this time the bowel is blocked up or it has gone somewhere else. You can have what's called change in bowel habit, where you've been going every day. Let's say every day in the morning you open, but now you're saying, oh, every 2 days, now every 3 days, and it's tough. I have to now go buy over-the-counter medications to try and go to the washroom.
People who are older are at higher risk of developing colon cancer because of just how the body works.
You develop cancers every day. You develop cancer every day. I develop cancer every day. But our immunity, our DNA is so strong that it keeps repairing things. I mean, it's amazing, the human body. It keeps repairing anything that is going wrong, and you don't even know it till it becomes very big. Now, what happens as you grow older, everything becomes slower. Your repair also becomes slower. So the DNA cannot repair the cancer anymore, the cancer cells that are coming through. And of course, you're more likely to develop cancer cells. And hence, slowly it increases. However, there are some preventative measures we can take.
We know that the patient immune system is a very powerful tool. What we did not understand is, why doesn't the immune system kill the colon cancer? Why does it kill the virus and doesn't kill the colon cancer? It's because the immune system looks at the colon tumor and says, this is part of self. It is like my own colon. We have to reprogram, re-educate the immune system to say, no, this is your cell that have had a mutation and have become malignant, so attack it. So the immune augmenting therapy is exactly that, to activate your immune system to look at your tumor as foreign and not as self. And they're all available here.
Because of this, screening, the experts say, is your best bet to catching these changes early.
Screening basically involves multiple steps. First thing is you can run a what's called a stool test, which is you usually do 3 stool tests. However, we need to warn you that it's not very accurate. We have seen patients where you can have a negative test and still have colon cancer. You can have positive test and it's not colon cancer, it can be something else. So we need to find out what the cause of that blood is. There are more accurate tests which are not available in our country. Basically, they're called FIT tests and DNA tests, which are far more accurate and done on the stool.
For people who have had a colonoscopy done, they will tell you that it is not very pleasant. From the procedures of prepping the bowel to be clean and clear of any fecal matter, to the discomfort of having a probe up your intestines. But this is necessary.
We do have now an enlarging population of Kenyan doctors who are now doing colonoscopies, which is very, very good, because now you have a bit more access to colonoscopy. Colonoscopy is done largely to patients who have symptoms or who are the age of 50, or if you got first-degree relatives or 2 first-degree and second-degree relatives, in which case you need to run a colon. If there is a personal history, if you suppose you had a colonoscopy and they found a polyp, you definitely need to review colonoscopies. And maybe even your first-degree relatives will need a colonoscopy.
There are different sections of the colon that the doctors will be looking out for the cancer.
There are quite a few different types of cancer. One is just incidental, where you get cancers. It can be on the right side, left side, what's called transverse colon, or it can be in the rectum. So in a way, they are treated differently. The rectal cancers are treated differently from the rest of the colon cancers, and what are called anal cancers, which is right at the bottom end, is treated completely differently. So you can have just incidental types, or you can have family predisposition. In other words, there is some family DNA that has passed through that has made you predisposed to cancer. For example, especially first-degree relatives, like parents, brothers, sisters, you need to be very aware that you need a colon cancer screening. It's something worthwhile for everybody to think about and get it done, especially if you're at the age of 40, maybe 45, because American statistics show that maybe we are now seeing at a younger age, and they're now saying that maybe you should start screening at 45.
The stage of the cancer will determine the kind of surgery that will be done.
They are staged from stage 0 to stage 4. Stage 0 being cancer that is limited to the inside lining of the colon, and this can be taken out by local removal of that cancer, what you call a polypectomy. Stages 1 and 4 will require to have a surgical excision, which means removing part of the colon. In essence, we remove about 1/3 to 1/4 of the colon, together with its envelope, which contains the lymph nodes, which will help us in determining further the staging of the cancer after the surgery, which will determine what treatment will be offered after the surgery. The vast majority of the patients that we see in our institutions are between the ages of 40 and 50, which constitutes about 33% of the patients that we see here. The worrying thing is that almost 20% of these are below the age of 40. Even more worrying is that those who come in stage 1 constitute only 12% of patients, with most of the patients coming in at stage 2 constituting about 33%. 40% of patients will come in at stage 3. Now, curability and survivability will definitely depend on the stage. The higher the stage, the lesser the survival figures.
In some instances, depending on the location of the cancer, the doctors have to develop an alternative route for stool to exit the body through the surface of the abdomen.
A proportion of patients, depending on the location of the tumor, will require to have what is called a stoma. A stoma is basically an exteriorization of the bowel in which now the fecal content will come out of the abdominal wall. Now, depending on the site of the tumor, if it is very low down and we are unable to join the intestines back together, then those patients will require to have a stoma.
Apart from surgery, there are other options for management of colon cancer that Professor Mansour Saleh, the director of the Cancer Center, talks about.
But the way chemotherapy works is it stops those cells that divide and in a way eradicates them. So in the context of a patient, the tumor divides very rapidly. So chemotherapy works on the tumors, but any cell that in the patient divides rapidly will also be targeted. So your hair, your blood cells, etc. The good thing is, the way we time our chemotherapy is it allows the normal cells to recover. Your blood cells recover, but the tumor does not have a chance to recover. I think cost is always an issue because the development of these drugs are going to be very expensive. However, I just had a big discussion yesterday. Clinical trials, when we do clinical trials, when we study these molecules in our patient population, because only 4% of patients on international clinical trials are minority African Americans. We say if you test these drugs in Kenya, 100% will be what you call minority, but for us are Africans majority. And these drugs have to be studied in the patient population in whom you want to apply them. So clinical trials are totally free for the patient. For the standard of care is given by the sponsor as well as these experimental drugs, which is why I think we want to promote clinical trials being done here. It's better for the patient because they're paid for, better for us because we learn to do the work in our patient population, and then we have access to these novel therapies that otherwise would only be available in the West.
Professor Abdallah emphasizes on the need to understand your chances of survival depending on the stage of the cancer, and therefore why screening is important to get this disease early.
Patients who come in with stage 1 disease, which is limited to the colon, have a 5-year survival figure of about 90%. Whereas patients who come in stage 4 disease, which is disease that has spread outside the colon, have a survival figure of about 10 to 12%. Now, most of our patients are coming in at stage 3 and 4, about 55% of patients who come to this institution. So if we could capture those patients earlier and do a proper surgical resection, then we will achieve a much higher curative rate. As you can see, only 12% of our patients will come in with a survival figure of 90%.
The reason during Colon Cancer Month we promote colonoscopy, testing of the stool for blood, is exactly that, to intervene, to catch that disease within that 10-year spectrum so you can increase your chance of cure.
That's all that we had for you on this episode of KTN News Health Watch. Be sure to join us next time, same time, for another discussion on a topic that matters to your health. My name is Dr. Mercy Korir.